Oh, are you fucking kidding me or what? Oh, that's better. That's better.
A long time ago, Abington Memorial Hospital needed a PGY3 resident. They searched long and hard, but there was only one suitable replacement. This is his story.
Okay, fuck it. I mean, I guess this is the site of my new job. It's a little smaller than Cleveland Clinic, but I'm excited to get ready. Fuck it. Let's go.
Now let's be honest. Abington is no Cleveland Clinic, though he did assimilate pretty quickly. There were still some things that he messed up.
Hey, buddy. Yeah, Res. What's up? It's Abraham. Listen, buddy. We're gonna. If you're not busy, we're gonna run the list. We're gonna run the list in pre-op. Okay, I'm sitting here in pre-op. Could you do me a favor? Call Jake and David. Yeah. Just let them know we're gonna run in pre-op. I'll be waiting here. Okay. All right.
Reza, are you sure you said to meet here in pre-op?
100% sure. Pre-op.
It's been like 20 minutes.
Maybe you got held up somewhere.
What the heck, man? What's going on here? It's been 20 minutes. I mean, where's these interns? I don't understand. 20 minutes I've been waiting here.
As he progressed through his time here at Abington, he quickly developed his own style.
Okay, buddy, look. This is a trauma phone.
Okay.
So if anybody calls this phone, you just pretend to be me, okay?
Got it.
Now, if it's a level 2, you can deal with it. If it's Jushak or something like that, you gotta pretend to be me, okay? But if it's a level 1, I guess you can call my cell phone, okay?
Okay.
I'm gonna be available, so just let me know if there's an issue. But for the most part, just take care of it, okay?
Okay.
All right, thanks, buddy.
No problem. All right, so Rez, 503 needs a med rec.
Hold on. If you're in the channel phone, hold on.
Hola, this is Abe, trauma chief. Oh, Dr. Yushak. Yeah, I saw that patient. Everything is fine with the patient. No injuries at all. Hola, this is Abe, trauma chief. Oh, level 2. From where? Doorstown. Fall? How old? Okay.
4-year-old female coming in from, it's a transfer from Doylestown, a fall from wheelchair onto a soft mattress. She's saying everything hurts. She's positive ETOH and is on Coumadin, Xarelto, and Luvenox.
Hey, sweetie, how you doing? This is Abraham, one of the chief residents. How you doing, sweetie? All right, airway intact. Airway's intact. You got any pains here? You got any pains?
I need another drink. Give me another drink.
Yeah, me too, sweetie. Abdomen is standard to palpation. You know what? Everything will look okay. Someone called Dr. She don't need to be a trauma. She's gonna be okay. Hey, who had the trauma phone? Anybody have a trauma phone? Hey, Dr. Josla, it's Abraham. How you doing, sir? Yeah. We got a patient. She's like 90, right, how? 92 years old, female. She coming in. She fall on Xarelto, heparin, and Lovenox. Yeah, I don't know how the fuck that happened, but she's on everything. She got some kind. She got some kind of pains, but I think we should downgrade her because she's not a real trauma. Okay. When I was in Venezuela, we got like 25 gunshot wounds. Okay, that was a real trauma. This is not. We downgrade her.
Despite his interesting and controversial style, there was still plenty of people who found him useful.
Hey, Dr. Shaddis, we got a consult down in the ED. It's for a 35-year-old with perforated diverticulitis. He was actually a sepsis down there. He looks pretty concerning. He has an elevated white count. He came in febrile. He's tachycardic. They did start antibiotics downstairs. But on exam, he's actually peritoneal. He's having a lot of abdominal pain. I think we should go down and see him because I think he may need to go to the OR.
Sounds like he needs to go.
Yeah, the only issue is he is Spanish-speaking only. But Abe is actually my chief. I think he was in basement with the pros. I can give him a call and Have him come down and meet us there.
Wake his ass up and let's go talk to this patient.
All right. He's over in 202 here.
All right, well, I did train in Miami a little bit. I got a little bit of
He should be on
Spanish.
the way. Okay.
All right. Senor, nosotros from surgery. Are you having dolor? All right, we need air. Let's go get.
Okay, I called and texted him.
Talk to him because this guy needs an operation.
Yeah.
so
Do
we need
you want to get more history from him in the meantime, or?
Yeah, but I need to. I can't talk. All right, Abe. Thanks for coming over. This guy's just like super sick. So
no
we
problem,
don't-
no problem.
So listen, sir. We need to take you to the operating room.
Okay, look, we're gonna have to do some kind of something on you, okay?
You have a hole in your intestine, and we need to go in there and get that piece of intestine out.
Okay, look, buddy, he's trying to tell you he's gonna have to cut you open, okay?
All right. If we don't get this out, you could die from this.
You're gonna have some big problems if we don't take you, okay?
So we're gonna take out the bad piece of colon that's in there, and then just because of how inflamed it is, we can't put the two ends together.
Look, you got a big mess in your belly, okay? And what we're gonna have to do is take that mess and throw it in the garbage and put the good stuff back together.
So once we get everything cleaned up, you're gonna have a bag temporarily.
Yeah, look, you're gonna make a caca in a bag from your belly, okay?
All right. We're gonna get you better though. All right, buddy.
Yeah, hopefully you're gonna be alive after the surgery.
Hey, Roy, it's Jacob. I just got called about this patient in PACU. I don't know much about him. I didn't get really any sign out. I was wondering maybe if you knew something. Looks like they got surgery earlier today. It just says Small's bowel removal with an ostomy. Belly pains. They took pathologia. Yeah, I don't really know what this is about. Who did the surgery? Let me see.
Essentially coming from an attending level at the Cleveland Clinic, his work inside the operating room was unrivaled. Outside the operating room, however, well, that work was also unrivaled.
Hey Nicole, this is interns, Nicole. Hey Nicole, how you doing? This is Abraham. Yeah, look, we just did a surgery today. She coming in with some belly pain, so we took her to the OR. She had to get some bowels out. Okay, so she got an anastomosis, she got a ostomy. Just take a look at her, and figure out, she should be okay. I mean, there was a blood loss. It was some amount, but it was whatever. Just take a look, figure it out if you can. And the other thing is, she got just a very small medrec. It's not really that big. Could you do the medrec and the orders when you come and take a look at her? Okay? Yeah. Just do it and a brief off note if you can do it. Thank you.
In addition to his sound clinical judgment, he was also a superstar when it came to academia and education.
So does anybody have any questions about this case? So we went through it pretty thoroughly.
Dr. Jaslov, I was wondering, what's the margin of resection that you typically do?
That's an excellent question. Actually, it's changed a little bit in the literature. It used to be you only needed to get about 3 centimeters away from the tumor, but recent studies show that you're better off getting 5 centimeters away. So you really want to try and get a 5 centimeter margin.
Okay, gotcha.
Hey.
Yeah, Dr. Jaslov, I'm getting everything you're saying. That's true, but just for everybody to know, it used to be 3 centimeters, but now we try to do 5 centimeters, just for everybody to know.
Thanks, Dave.
He was so affable, it was really easy for him to become a good role model for all the interns.
Hey Abe, so we just got called about a guy in the ED. I saw the guy. He's kind of concerning, but I'm a little bit nervous about calling Dr. Nussbaum and presenting the patient. Do you have any advice for me before I give a call?
All right, buddy. Look, first of all, have you never presented a consult before? This is crazy. I don't know why we're even talking about this, but look, when you present a consult, you gotta make sure that you're giving all the information, and you gotta make sure he understands what you're saying. You gotta make sure that he feel like you know what you're talking about. Look, the bottom line is you want to make sure they understand what you're saying, okay? When you talk to them, you gotta be clear, and you gotta have a plan, and you gotta know that they know what you're saying, okay? Just for you, I'm gonna call the attending, okay? Which one was it again, Nussbaum? No problem, man. Me and Nussbaum, he knows me very well, no problem.
Okay, thanks Abe, I really appreciate it.
Like Dr. Nussbaum.
Hello?
Yeah, it's Abraham. How you doing, sir? Yeah, look, there's a lady, she's a 55-year-old female. She's coming in from Lansdale. She was transferred here earlier today, and she got belly pains and foot pains. You know, we took a look at her and we figured out that she had a appendicitis. So she's gonna come in, we're gonna put her antibiotics. You know, we're gonna make sure her pain is controlled, but we're not gonna use any PCA or any narcotic. Just we're gonna use you know, Tylenol and maybe some Toradol. But you know, we're gonna admit her and we're planning to do some surgery tomorrow. If that's okay, sir. Okay.
What was that?
I'm not sure. Did anybody order Mexican food?
So Abe, what are your graduation plans after you get out of Abington?
You know, I'm gonna go down to Miami. Actually, it's in Western Florida, and go to a Cleveland Clinic.
Cleveland Clinic. Cleveland Clinic.
Right, Cleveland Clinic. At Cleveland Clinic.
Cleveland Clinic. Cleveland Clinic.
Cleveland Clinic. Cleveland Clinic.
Cleveland Clinic.
Cleveland Clinic.
Cleveland Clinic.
Know what you're talking about. So this time I'm gonna call Dr. Nussbaum. I'm gonna let him know. Oh.